I just want to give each of the speakers an opportunity to give us maybe one or two takeaways from this. Wanda, we'll start with you.
So I think that there's a lot that we can do, but one area that's really critical for states is to think about ensuring risk-appropriate care. We need to standardize and approve care to ensure that all women are delivering at the right place and the right time and the right hospital.
Anna.
Yes, I would like to emphasize that the U.S. is part of the globe and that we should break that silo too and think about maternal health for all women everywhere, or women's health, if we want to be more inclusive. So that's one key message that I would like to share with you. And another one that comes from low and middle income countries is that many of those countries have made maternal health care free and available for all women. And those countries are much poorer than the US. So I think it's quite appalling to think that so many women still face financial barriers to have access to quality care in a timely fashion. So what can I say? I would encourage us all to push so all women in the US have free access to maternal health care.
Thank you. Haywood.
We have to re-educate on the importance of the postpartum visit and postpartum follow-up and early postpartum follow-up for all women, irrespective of where they live. We know that women who are poor are less likely to show up for that postpartum visit, mainly because of barriers. And we need to make sure that that's emphasized at the time of discharge from the hospital, that the patient understands the importance of us, providers understand the importance of it, and systems understand the importance of that visit. And we need to be able to have coverage for women for an extended postpartum period. It's not a one episode visit. It really is seeing the patient when she needs to be seen.
Susan.
It's always hard to go last. Everyone's made some fabulous
No, you're
not
last. Karen's last.
Oh, I'm sorry. Sorry, I forgot about you, Karen. I apologize. You'll have a hard time, I promise. However, I think really it's this maternal mortality thing is so multifactorial, and hospitals really need to be held accountable for their state of preparedness and their ability to respond to emergencies as they arise, regardless of who the patient is, what color she is, where she gives birth. It needs to be across the board a level of accountability, like I said, from the C-suite all the way down to the frontline caregivers.
Karen, final thoughts.
Two, so I really want to advocate and hold, again, as we're saying, systems accountable for, I'm going to say, the cultural rigor and humility and responsiveness and the scientific integrity and validity of our work, and also to dismantle the silos, to invest in public health and social sciences as transdisciplinary approaches that really center and uplift the voices and knowledge and expertise of our Black mothers and birthing people.